Hi, I am Dr. Bandana Chawla. I am a board-certified physician in internal medicine and lifestyle medicine. And I went vegan February 1st, 2013, and actually our 10-year vegan anniversary will be coming up soon.
And why would you do that?
I'd like to say that you hear about patients eating healthier because their doctor had a talk with them. In my case, I became a vegan because my patients had a talk with me. The end of 2011, I believe, the universe kept sending me vegan and plant-based patients. And as you know, vegans are not shy about letting you know that they're vegan, and they're not shy about how much better they're feeling and about educating you about the benefits of a vegan diet for the animals, for the environment, and for the health. I kept getting these vegan patients. And at first I was like, oh, that's good for you. You know, your cholesterol's come down. Obviously, it's made a difference. You're not needing your asthma inhaler anymore. That's great. You're losing weight. That's wonderful. But I don't have those issues, so I don't need to change my diet, right? So we're very reluctant to change. So even though I was happy for them, I wasn't ready to change myself. When it kept happening over and over again in terms of these vegan patients, and my husband at this time had recently become a vegetarian. So first 15 years of our marriage, I was a vegetarian and he was an omnivore.
You were a vegetarian from birth.
Lacto-ovo.
Okay.
So I had eggs and milk, yes.
Okay.
He had recently gone to a meditation retreat and had come back with more feelings of mindfulness, compassion, nonviolence. In August of 2012, he became vegetarian. I was telling him about my vegan patients, and he just came out and said to me that if all these years you've been vegetarian for compassion and nonviolence reasons, then the research that we're doing now in terms of looking at dairy and looking at what your vegan patients are saying, if it's for compassion and nonviolence, then you have to go vegan. And that kind of was a little hard on me because here's this guy who's been omnivore this whole time. And he is now willing to take the next step, and I'm the one being reluctant and saying that, oh, the kids are younger. When they go off to college, then we'll become vegan. I was going to turn 40 May of 2013, and so we said January 1st of 2013 that we're going to start our transition. We're going to start slowly moving to a vegan diet, and hopefully if we are feeling okay, then on my birthday we'll be ready to announce to friends and family that we're vegan. So January was going so well. And we were reading more and more, right? We were doing the 21-day kickstart or other things, other supportive things that were there in terms of helping us transition. I believe the third week of January is when we had already kind of stopped the dairy, but we were still doing, Costco used to have these organic, range-free eggs that we still had in the house. And we ran out of those the end of January. And then he said to me, do you want to do this sooner than your birthday? And I was like, oh, I'm so glad you asked, because I was thinking the same thing. So we actually made February 1st, 2013 our official vegan day.
So did you notice anything different going vegan physiologically, mentally, or emotionally? Anything change there?
Yeah, I did. So like I said, I didn't have any major health problems. I'd always been a pretty good BMI, never been overweight or obese. And so when my patients were seeing all these improvements, I was like, okay, I'm not really doing it for health reasons. It was more totally for ethical reasons that we went vegan. But I'll tell you, I had migraines in my life before, which I didn't pay much attention to because I thought it was a minor thing. I only had them every few months. It wasn't too debilitating, but it was there. Ever since I started my periods, I guess, they were kind of menstrual migraines to where the hormones affected them. After I went vegan, I have not had a migraine for almost 10 years now. I believe it's the dairy.
Oh, okay.
So we do know migraine, especially for women where they're hormonally related, it depends on not just the hormones in your body, but also the hormones in your diet. So meat and dairy have hormones in them, dairy even more than meat. The hormones are naturally there because the cows have just given birth and they're actually impregnated again right after they give birth to make a good profit. You get them pregnated again because they can keep lactating. They have pregnancy hormones, they have lactation hormones that are coming naturally in the milk, but then in this country, we give them even more hormones that are actually not even allowed in Japan and Europe and other first world countries in terms of bovine growth hormones and other things to increase the milk production. And all those hormones then come to us when we ingest dairy. So as soon as I took the dairy out, the migraines just resolved.
Wow. Anything else change?
Yeah, a few other things in terms of skin. I would occasionally have acne issues, which again, acne has big hormonal link. And it's funny because now my sons, when they were teenagers, they had acne issues and their dermatologist told them to take out the dairy. And these are not vegan dermatologists because the link between dairy and hormones and acne is clear now. So that the skin got better, a nice, healthy vegan glow. And then another thing that improved was allergies. So I had been on Flonase and Zyrtec for years. And I just thought that's part of living in Houston, Texas, which Houston, Texas is definitely a place where allergies are an issue. But after going vegan, I was able to get off of Flonase, which is a nasal steroid. And I know we used to say that nasal steroids don't have the bad side effects of steroids, but now we know that long-term nasal steroids do actually increase your risk for osteoporosis, just like steroids definitely do. So I was happy to get off of nasal steroids because my mother has osteoporosis and I'm at high risk for many other reasons. So, and then over time then also got off of Zyrtec. So I was still on a thyroid medication until actually recently, which is more lifestyle medicine that I attribute that to. Yeah, so I am 49 and a half years old and on no medications. And I totally attribute that to...
You look like you're 18.
Oh, thank you. I have 2 sons that are in their 20s in college.
I bet people trip out when they realize you're their mom.
Yeah, I know, because one of them has like a full beard.
Yeah.
When we were doing college tours,
Yeah.
there were times when people were thinking that I was looking for colleges for myself instead of looking for colleges for my son. So that's a nice little side effect of a vegan diet. Yeah. But I've been a lifelong vegetarian. I've been practicing things like yoga and meditation, all the lifestyle medicine stuff for a little while, more now than before, but all that helps.
What about internal medicine? How long have you been practicing that?
Over 20 years.
And you only recently got into lifestyle medicine, right?
Lifestyle medicine, the first board exam was given in 2017, and I found out about it on Facebook actually because one of the other plant-based doctors, she posted that she's now board certified in lifestyle medicine. So when I looked up about lifestyle medicine, I was super excited. So my husband and I took the board exam in 2018 and we both got board certified in 2018. It's funny because the day I found out about lifestyle medicine, I came home and spoke to my kids. Both of them were still at home then, hadn't gone off to college yet. I had slowly already been talking to them about plant-based nutrition a little bit more. I had been talking to them about meditation and yoga and exercise and a lot of the things even before I knew what lifestyle medicine was. And my sons would tease me that I was becoming a hippie doctor. And I came home that day and I told my sons, no, I'm not becoming a hippie doctor. It turns out I'm becoming a lifestyle medicine doctor.
It's so funny you should say that because I was at the National Health Association conference recently.
Yes.
And that's all about eating whole plant foods, no salt, oil, or
Yes.
sugar. And it's not really like vegan, like a vegan retreat or immersion, anything like that. And I was interviewing people, and a lot of those people were purely there for health, weren't even thinking beyond that much, if at all, that I even interviewed. And one or two of them did associate it with this connotation of being like a hippie thing. So I'm so glad you kind of said that, because I think people do have some sort of odd interpretation of what it is. So what is vegan to you?
To me, a vegan is someone who is compassionate towards all sentient beings, who is not just caring about Homo sapiens, which of course I care a lot about Homo sapiens, but I also see that anybody who is able to feel pleasure and feel pain, and anybody who wants to avoid death and wants to avoid suffering, it's really not that different than me. I think what helped me see it a little bit more was being a mother myself and seeing how attached I am to my kids and how much their joy and their happiness means to me, and then kind of seeing how it's not that different for a mother cow. For her calf, she feels that same amount of love and attachment, or for a lamb and a sheep, or especially for mammals, I could really see that because they breastfeed their babies. They're really in the same class as us, and scientifically, when you look at dogs, cats, humans, goats, lamb, cow, pig, we're in the same mammalian class. And we have a lot of similarities, including wanting to take care of our young and wanting to have that connection with each other.
Do you have any regrets?
I think like many other vegans, my biggest regret would be not coming to that realization sooner and waiting till almost 40 years old for making those connections and becoming a vegan. But better late than never. So no regrets since becoming a vegan. No.
Why didn't you do it sooner?
So I think a lot of it is culture and what we're taught and what we're told is normal. And we, a lot of times, especially at physicians, think normal is what is natural and healthy, right? So when we see lab results that are in the normal range, we think that's natural and healthy. So when society and culture tells us eating meat or eating dairy or eating eggs is normal, we think it's natural and healthy until we really kind of sit down and think for ourselves. A lot of times we're not really encouraged to think for ourselves, and we just follow along with what everybody's doing. And especially in Indian culture, dairy is just so big and so encouraged. Like, it's considered that you must have dairy for health reasons and for other things that my parents would actually make me drink milk 2 to 3 times a day. I actually never liked the taste of milk because they were told by everybody else that if they wanted me to get taller, which I didn't get taller, that I needed to drink milk. So during my teenage years, they were like, this is your last chance because then you won't be able to get taller after this, so drink milk. So it's just a lot of what we learned from, and they're doing their best, right? Because they learned from their peers and their parents, and I didn't do it sooner because I was affected by society and culture.
Do you think your culture looks at this negatively?
Like me saying no to dairy when they offer it to me?
Yeah.
Yes, at times, I think so. I think it was even hard for our parents when we first said we won't be eating the desserts that they would make for us, or many things that they made that we really enjoyed. We said we're not going to eat this anymore. But I think over time, they kind of see and they respect you for what you're doing. And so I think all of our parents are very proud of us for being vegan. My husband's mother has actually become vegan herself, and she became a vegan at 83, and she is 88 years old now. She's very healthy because of her plant-based. You actually met her yesterday at the retreat, probably. She was at the retreat yesterday. Yeah, she was the 88-year-old that was there. And my parents also have actually become 95% vegan. So at home now, they get non-dairy milk, non-dairy yogurt, because milk, yogurt, all these are very big part of Indian diet. But they're a little reluctant socially, to where if they go to a friend's house and somebody wants to give them chai, which has dairy in it, they'll do it outside their home. So they're kind of vegan at home. Society and culture just is so much stronger for them.
Stronger than knowing what the animal goes through?
Yeah.
Do you ever try to go there with them on that?
I have, but I've also learned to be very appreciative that they're 95% vegan, which, for an Indian couple in their 70s who is very involved socially in the Indian social scene is not easy to do. So I've learned to stop bothering people about being 100%, but also encouraging them and appreciating them for the efforts that they are making.
Well, thanks for sharing, allowing me to probe that.
Yeah.
So as far as like internal medicine, describe that. Like, what's that all about?
So internal medicine is basically primary care for adults. There are a few primary care fields, right? Pediatrics would be primary care for just kids. Internal medicine would be primary care for just adults. And family practice is primary care for adults and kids. So that would be the easiest way to explain it.
During that 20 years prior to this vegan lifestyle medicine stuff, did you ever spend any time with your patients on anything related to lifestyle? And what kind of diseases were you working with predominantly?
So internal medicine is predominantly adult diseases, which now happens to be diabetes and high blood pressure and heart disease. We also do like annual checkups and well-woman exams and pap smears and EKGs and spirometry, pulmonary function tests for asthma. And so that is, what internal medicine is, the bread and butter of internal medicine. Whole grain bread and vegan butter. In terms of before, I think I did a little bit, not nearly as much as I should have. I went to a wonderful medical school, Southwestern in Dallas, and I trained at a nice residency program in the Texas Medical Center in Houston. But the emphasis at both of those programs was not on nutrition or lifestyle or diet. Unfortunately, we're just taught a lot of pharmacology. We're taught, for this disease, you offer either this drug or this procedure. So it's really all about medications and procedures. And unfortunately, that's what I mainly offered as well. And I still do that. I still write for plenty of Lipitor and metformin and those medications. But now I also offer lifestyle medicine. I also tell them that that is also a therapeutic tool. And I understand not all of them can do that at this time in their life, depending on what's going on. And right now, sometimes they can just do the medications, and that's fine. But I think the doctors need to at least let them know that lifestyle is another therapeutic option, which is something that we haven't been taught to do. My husband and I are also clinical faculty, volunteer clinical faculty at the University of Houston College of Medicine. So we are trying to bring that in more in the medical education. I am a clinical preceptor for nurse practitioner students at UTMB and Texas Women's University, and also clinical preceptor for medical students at University of Houston College of Medicine. So I really try to kind of educate the next generation of health professionals about the importance of this.
It's easy to assume that practitioners are very inundated with their job and there's so much to learn just to become that. Is there any room for them to take on more, something like this? Is there any time to implement it, and is there any room in their education?
Well, you make room for what's important. And that's partially where we want to go, is understand that this needs to be a priority. And you make room for your priorities. I don't know if you've seen the documentary Code Blue or ever interviewed Sarah Stancic. Yeah.
I did video her talk, and it's a really good talk.
Yes.
But I haven't seen that yet. I need to.
Oh,
I've been
yes.
too busy making videos.
Yes, you should see it. That really goes into the medical education and how we're trying to change it and bring changes. So I'll give you the example of University of Houston College of Medicine, the one that we work with. We actually did 6 lectures at the medical school for the 6 pillars of lifestyle medicine. And after every lecture, we gave them a little practical session. Stress management, after the lecture, we did a little mindfulness meditation for exercise. After that, we had a yoga teacher come do a little yoga session with the medical students. And the most popular one actually was nutrition, where we talked about whole food plant-based diet, what they should do to try to encourage their patients to become more plant forward, decrease their animal foods and processed foods, and increase their whole plant foods. After that lecture, the medical school actually had a teaching kitchen that they had never used. So we finally had them use the teaching kitchen, and we had raw chef come, and the students actually had 6 different stations, and they did a little cooking class. So we did a cooking class where the students made food. They made a little appetizer, a little meal, and a little plant-based dessert at the medical school. So these kind of things need to be done, and I think people are starting to see that that's important and that needs to be a priority.
What % would you say of the patients that you've seen over the 20 years came to you with chronic diseases or for any reason due to lifestyle behaviors?
So you know the data and the number says over 80%. And I would say it would be the same in my practice. So over 80% of chronic diseases in today's world, according to CDC, are due to diet and lifestyle. You know, it surprised me in the sense that I expected diabetes, gout, heart disease to be on that list that CDC put of diseases affected by diet and lifestyle. But they also included many autoimmune diseases, cancers, a lot of mental and emotional diseases that are also affected by diet and lifestyle.
Of those 80+%, how much of that do you think is related to food specifically?
Yeah. I think, so lifestyle medicine, you know, we have 6 parts. We have this infographic that I like to show that everything is like a puzzle piece. So nutrition, which because it's an evidence-based field, they recommend a predominantly whole food plant-based diet. Exercise, stress management, sleep, healthy relationships and healthy community, and then avoidance of tobacco and limiting alcohol. Of those 6 pillars, personally, I think nutrition and sleep are probably the biggest things that affect our health.
There's a lot of talk about carnivore diet. They're eliminating processed carbs and other processed meats, maybe they're eating more raw meat, I don't know. What foods are the primary culprit in that?
So in terms of carnivore diet or keto diet, I do have patients who come in with that, and I try to be where we find a common ground in terms of, you know, I say I agree with not eating processed foods, and I think these ultra processed carbs are horrible for you. So we definitely have that connection. So once we've found that common ground, then I try to bring in the that when they're not eating the healthy carbs, the ones made by Mother Earth from the ground, they're losing out on a lot of antioxidants and a lot of things that have anti-cancer properties. So first the common ground, then the benefits of the healthy plant foods that this diet is taking away from them. And then I'll go into how the meat diet causes issues in terms of saturated fat and cholesterol and heart disease and diabetes and also cancer, right, increasing their risk for cancer. So I try to take it slow and step by step, and I am very happy to claim that some of my keto patients that used to be keto on a keto diet are now vegans and on a plant-based diet. They're just trying to do something that would be better for their health and trying to lose weight and trying to get healthy. And so, yeah, so patiently and lovingly trying to show them parts of what they're doing is very good in terms of taking out those processed carbs, but there are other things that we can do better.
Do you look at the science, beyond whatever you may need to do?
Yeah. So that's part of being a plant-based doctor is looking into that. So the first few years after going vegan, we were kind of like closet vegans. I kept that separate than my practice, really. I wouldn't talk about healthy diet and lifestyle as much. This is 2013 to like maybe 2015. 2016 is when I actually met Dr. Neil Barnard in Dr. Garth Davis's house. Dr. Baxter Montgomery had a conference where Dr. Neil Barnard was one of the speakers, and Garth Davis, the night before the conference, did a little dinner at his house that would benefit PCRM, Physicians Committee of Responsible Medicine, that Dr. Neil Barnard is with. And I guess I had donated to PCRM a few times. So PCRM invited me to that dinner. And when I met Dr. Neil Barnard, he basically said something to me saying, you have a responsibility as a plant-based doctor to improve the health of your patients by talking to them about plant-based nutrition. And that changed everything. And then I started going out and doing talks on blue zones and plant-based nutrition at different places. And to do those talks, then I had to do the research, and I had to look in the data, and I had to make the slides, and I had to read the China study, and I had to read about Dr. Esselstyn and Dr. Dean Ornish. I was just being a vegan and a doctor as two separate things for a while. And that made me become plant-based doctor and then later a lifestyle medicine doctor.
In the literature, the science, is there anything at all suggesting even remotely that we need to eat animals for optimum health span?
No, there isn't. Very much on the contrary, in terms of when you look at epidemiologic studies and times historically, times during World War II and other times when people actually stopped eating meat because they couldn't get meat. Very quickly, the data and the health improved in terms of lowering risks of heart disease and lowering events of diabetes and episodes of things in those populations. And when we look at blue zones where people eat a predominantly plant-based diet, now many of them don't know what the terms vegan or vegetarian mean, but about 17 of their 21 meals a week happen to be plant-based. We know that those are the people who have the most centenarians, people living over 100, and they're not just living over 100, they're living a healthy life over 100. Like these 100 and 200 and 3-year-olds, they don't need a cane or a walker or a wheelchair. They're biking to their grocery store to get what they need for the day. They don't have dementia. They're still involved in the community and active. They have 1/5 the risk of cancer, 1/5 the risk of diabetes, 1/5 the risk of heart disease that we do. The best studies, I guess, would come from Adventist health studies, because Seventh-day Adventist in Loma Linda, California, which is a blue zone, which surprised me that an hour away from downtown LA would be a blue zone where people live 10 to 12 years longer than rest of Americans. The studies we have from there, they can compare exactly, people who are non-vegetarian, people who are pescatarian, people who are lacto-vegetarian, and people who are vegan. And what we see in those studies is that as you go more and more towards taking out all animal foods, the BMIs improve, the risk of diabetes drops. The risks of high blood pressure drops drastically. So the closer you can get to a no animal food diet, the healthier it is for you.
A lot of this is criticized because it's observational, epidemiological. What is the most rigorous you've seen out there evidencing this?
I guess the most vigorous would be the studies related to heart disease, because a whole food plant-based diet is the only diet that's been shown to not just stop plaque formation from going further, but actually reversing it. So it would be probably Dean Ornish's studies or Dr. Esselstyn's studies that show that a plant-based diet can not only prevent things, but actually truly reverse things. In terms of, we have pictures of cardiac caths, right? The arteries and the plaque that was before, and that's now gone.
Is there any evidence supporting keto or carnivore like at all?
No. So they actually tend to rate different diets in terms of their health benefits, in terms of Mediterranean diet, and keto diet consistently comes at the bottom of the list in terms of the unhealthiest diets for us.
So why are people doing this?
Well, I'll tell you, it will give you short-term weight loss. There is no doubt about that. I see patients who are wanting to lose weight before their wedding or something like that, and this will definitely get them there. What I like to tell them is, one, it's not sustainable. You can't really eat that way long term. Even if you can, you really shouldn't eat that way long term. As Dr. Michael, I don't use these words, but I'm reminded of them. Michael Greger likes to say, the goal of weight loss is not to fit into a skinny casket. So I tell them that my goal as their primary care physician is to see them be healthy long term. Through their 30s, through their 40s, through their 70s, through their 80s. My job is their health first and foremost. And a keto diet is not good for their health in terms of increasing their risk for all sorts of things, including heart disease, diabetes, and cancer. So I want to encourage them to eat healthy and exercise and manage their stress and do everything that will make their life better in their 70s and their 80s.
The doctors that I've been trying to interview, some of them are very busy. They're like doing, like Garth Davis was doing like some days 5 surgeries, and even in the middle of the night he'll get called into doing one. Dr. Baxter Montgomery, he had to cancel on me last minute because he had so many people in his waiting room. And Brooke Goldner, she just has so many things going on. But then you have these carnivore doctors, they're just YouTubers to me. Like, they're not even practicing,
right?
And they're not dealing with clients all day. They have time to get on YouTube and create videos.
I'm a little disappointed with the whole way things are going, not just with misinformation on medical stuff, but misinformation on everything on social media. And these kind of things grab people's attention. And these headlines are what people want to see. They want to see butter is back. They want to see, carnivore diet is healthy for you. And it gets some clicks. And so much right now is about having those clicks. They're okay with not having the science. I'm just overwhelmed with and really saddened by the whole way the media culture is going.
Now, yesterday you had a big retreat day that you closed with a very emotional and sweet closing. It brought a lot of emotion out of me. You're very passionate with what you do beyond the practice. Are you still practicing internal medicine?
Absolutely, yes.
And you're so busy with this other stuff.
Yeah.
It's so sweet that you offered to do this on top of everything else you're doing. I know people are probably going to be curious how they can find such a good doctor.
Oh, okay.
Do you have any resources for people, and how are you accessible?
So my husband and I are only board certified in Texas. So if you are anywhere in Texas, we can see you on telemedicine and we can help you. I take insurance, Medicare, all of that. However, if you're out of Texas, we cannot help you as doctors. But we are happy to still help you with resources. So our website, lifestyledocs.com, has a lot of resources on there, recipes, videos. We provide a lot of community and support to our patients. So the good thing is during the pandemic, a lot of these things also became available on Zoom. So even if you are outside Texas, you're welcome to join us on our meditation sessions because they're also on Zoom. Some of the cooking classes are also on Zoom. Some of the yoga sessions are also on Zoom. So you can go to our website, lifestyledocs.com, and we're also on Facebook and Instagram as Lifestyle Docs. And you can go under the events tab on our website, and you can see things like every first and third Saturday of the month, we have meditation at 9 o'clock, and then yoga afterwards. And on certain weekends, we have cooking classes. We do plant-based potluck here at the clinic, but that's not on Zoom, and there's no point of that because the whole point is to have the community come together and bring healthy plant-based dishes that they can share with each other, and they can share recipes with each other, and they can see how somebody else makes chickpeas or tofu. And it's really, you don't have to be plant-based to come. You don't even have to be our patient to come. It's open to the community. You do have to bring a plant-based dish without oil and without sugar. But yeah, we have a balcony out here and people set up, and once a month they have that community to where they can so yeah, you can join us on our online community if you're outside Texas. But if you're in the Houston area, you can come to our potlucks. You don't have to be a patient.
You have a quote you like to share? Besides the Gregor one.
Oh, yeah. I think one of my favorite ones these days, especially when you said, do you have any regrets, is Maya Angelou's quote saying, do your best until you know better. When you know better, do better. And so that's kind of what I try to remember for myself is there are many things that I haven't done better, but I didn't know better. Once you know better, then you make an effort to do better.
Is there any last minute encouraging words you want to share?
My thing would be, and I kind of said that at the retreat yesterday, is to just go ahead and take the first steps. I know a lot of times we want everything to align before we start on a journey that we do want to start on. We know we want to start on it. And I was the same way, right? I told my husband that, yes, I want to be a vegan, but right now it's not a good time. You know, we've got kids, we've got this, and when they go off to college, then we'll become vegan. Just start. And if it takes you a long time to get there, that's fine, but don't put off the start. That would be my advice. Start taking those first steps, and if it's a slow journey, that's fine. If it's fast, that's fine. But start the journey.
I know people are going to be curious about like what food that you enjoy eating on a day-to-day basis.
I like to tell my patients the old British saying, eat breakfast like a king, lunch like a prince, and dinner like a pauper. So that's kind of what I do as well. I have a huge breakfast. I have a big beer glass of green smoothie. I have a big bowl of rolled oats and fruits and berries. And then I also have something savory at the end because I can't just end with sweet. I have to eat something crunchy or savory. So it can be something like Ezekiel bread with avocado on it, or hummus on it, or sprouted mung, lentils, or even if nothing else, like a couple of Mary's Gone crackers to have that crunch. And then for lunch, I bring my big lunch box to work and I put it in the fridge. That usually often also has a bit of green smoothie. It has a side salad, and then it has basically a grain, lentil or beans, and a veggie bowl. So it's the mix of any kind of whole grain. It could be quinoa or millet or rye, or I'm exploring a lot of different rices now. So there's, people know about white rice and brown rice and wild rice, but there's also like black rice, and there's also red rice, and so those are also whole grains. White rice is, a bit processed and polished, but red rice and wild rice, black rice, and they don't have the arsenic issue that the brown rice has. So I've been doing those rices. And we do some kind of lentils or beans. It can be black-eyed peas, black beans, chickpeas, red kidney beans, and then some kind of veggies. So that's kind of like my maybe chipotle bowl, you can call it, because it has some grains, some veggies, and some vegetables. And then I do a lot of fruit. So I'll do clementines and apples and berries and pears, and summertime was the stone fruits, so mangoes and peaches and nectarines and plums. And then dinner, I kind of keep it lighter. And then we like to do a little bit of intermittent fasting when possible. Some people are trying to do 16 hours, but the new data seems to show 14 hours we don't need to go to 16 hours. Even 12 to 14 hours is beneficial. Usually we get about 14 hours of a break. So tell my patients to give their digestive system a break. I like to explain it as, one, your body's, for people who are trying to lose weight, your body's never going to go into fat reserve unless there isn't sugar, glucose food coming through, because otherwise it's much easier to just take what's coming through. No need to go in the reserves. So you got to give it a break for that reason. And the other reason is for just health and healing. For my patients who are trying to reverse diseases, including autoimmune diseases and other things, you can't repair roadblocks if there's always traffic coming through. So kind of just stopping the traffic of food coming through for a good amount of hours, so the body can do its healing and its repairing, because it's really good at that.
What about raw? Do you think you'll ever go in the direction of raw?
I would love to. Some of the raw people I've met, they just look amazing.
Yeah.
I don't know if you've ever seen Chef Babette.
Yeah, I'm supposed to interview her.
Oh, wow. Yeah. She looks absolutely amazing. And she's been raw for like decades, like 40 years.
Yeah, and Annette Larkin out of Florida.
Yeah, yes.
And I've talked
Fully
to her.
Raw Christina used to be here in Houston, actually.
Yeah. Oh, wow. And then I did interview recently Karen Calabrese.
Yeah.
She's 75, raw, 50 years. Yeah, she looks amazing, yeah.
Yeah, so I think it's totally great that they're doing that.
Yeah.
For me personally, I am a physician, and until recently I had 2 teenage boys at home. It just takes a lot of time, I feel like, to sit and chew so much. So for me, I do need some cooked foods just to get enough calories in a day to keep doing everything that I need to do. We are incorporating more and more raw in our diet. Like the smoothies are raw, and I don't have to chew, and I can quickly get a lot of raw food in that way. And then the fruits, of course, are all raw, and then the side salad is raw. I think compared to like 3 years ago, I'm doing more raw than I used to before. 100% raw, I can't see that yet, but then I'm doing things right now that I couldn't see in the past, so I don't know. But at this point, just in terms of the time that it takes, just buying so much raw food and then consuming so much raw food, it just lentils and beans and those things, I can get those calories quickly and they're nutritious. Yeah, I guess it would take away grains and lentils and beans from me.
Not really, because you could
sprout them. I know. But that would be learning a new thing, and I know how to use my Instant Pot so well, and my Instant Pot works really well for me.
Yeah, it's a lot easier to throw it in an Instant Pot than rinse and drain 2 times a day every day.
Exactly.
Yeah.
So maybe later, maybe after I retire.
Yeah. So really, that's the only difference. I don't know that it's more. You just have to sprout.
Yeah.
And they also ferment, like she ferments too.
Yeah, and dehydrate. Yeah. It's just learning new skills, I guess.
Exactly, yeah. But it sounds like you think it might be a great direction. Next level.
Yeah, perhaps, yes.
Awesome.
Yes.
And so to close it, how can people find you online? What's that address?
Yep, so our for-profit clinic is lifestyledocs.com. And it was so great that we got that domain name. And we're on Instagram and Facebook. And our nonprofit is called Peaceful Planet Foundation, and it's also on Instagram and Facebook.
Cool. And I'm curious real quick, what do you have in store for the future?
Oh, I don't know. I don't tend to think of that. I just go with the flow, and the universe is always kind of guided me a certain way, and I've just gone that direction. I would have never thought that I would be doing what I'm doing now 10 years ago. I think at this point, just more of lifestyle medicine.
What about like with the Peaceful Planet Foundation? What's next?
Oh, Peaceful Planet Foundation, yeah. So we are getting into some underserved areas of Houston and taking mindfulness programs into schools. We hire yoga teachers, and they go out to schools and teach them what we call the 5M program: mindful breathing, mindful movement, mindful stillness, mindful eating. We provide plant-based snacks and mindful reflections. With our for-profit, I'm working towards the health and wellness of my patients, right? With the nonprofit, we're working towards the health and wellness of our community. And we feel like at the stage in life that we are, that's really important, to where we take it to not just our patients, but other people who are not going to be exposed to lifestyle medicine doctors. You know, they're in food deserts, and they haven't heard about all of these topics. So yeah, I do hope to be more involved with that in the future. Thank you for making me think of that. Actually, if you have time, I'm going to mention one more thing, and you can totally cut it out if you want.
Okay.
So part of Indian culture, we are taught, though nobody follows it, that life should be divided into 4 quarters. Okay, so the first quarter is what's called Brahmacharya ashram, which means your student celibate life years. You focus more on your studies, you focus on that. The second quarter is household years, where you focus on your career, you focus on your family. The third quarter, which is what I am entering as a 50-year-old, about to be 50-year-old, is considered community service years, to where now the kids are grown, the kids are in college, the career has been so good, now we focus on giving back to the community. So that's where the nonprofit comes in, and that's why we're hoping to be lessening our for-profit stuff and increasing our nonprofit stuff and doing more for the community. And then the fourth quarter, which would be 75 to 100, where it gets even harder to be active in the community, is when you're supposed to even more kind of go inwards and focus on your spirituality and focusing on just not grasping so much and more acceptance of what old age brings.